Merci, Elvire, and thank you all again for your attention and for the invitation. I'm going to talk a little bit about bracing and ACL reconstruction this afternoon. I don't have any relevant disclosures on this topic. So, as we know, brace use after ACL reconstruction is pretty controversial. If you go to enough conferences, you'll hear people up on stage saying they always use a brace, some saying they never use a brace, some saying they sometimes use a brace. And I feel like I wanted to take an evidence-based look at this and see where we really should be, and if we can even know where we really should be on ACL bracing at this point. So I'm going to break this down into two types of ACL braces: post-operative ACL bracing to be used in the immediate post-operative period, and then functional bracing that we would use later on in the recovery. So again, my goals are to review the data surrounding post-operative bracing with a real focus on evidence to support bracing, and then discuss some specific situations for both of these types of braces. And I'm really going to focus on randomized trials where it's available and comparative studies where there aren't randomized studies. So post-operative bracing was historically the gold standard after ACL reconstructions. There was classically an avoidance of knee hyperextension or even full extension to protect the graft after surgery. Work by Don Shelburne and many others around the world have changed that philosophy with our focus now on early restoration of knee extension in the early postoperative period. And that's led to a lot of questioning as to whether there's a need for these braces, or even maybe some of these braces may be actually harming patients in some cases. And we certainly know they're not free, so we'd really only want to utilize them if there really was a clinical benefit. So what's the evidence? Again, we're going to focus on randomized trials, in particular when they're available, and comparative data. So with patellar tendon autograft reconstruction, there was a nice study in 2006 by Haralainen et al., a randomized controlled trial, almost 70 patients, all ACL reconstruction with patellar tendon, and randomized to either a brace or no brace for 12 weeks. They had 5-year follow-up in 75% and found no difference in failure risk or any outcome between the two groups. Similarly, Meyer et al. In 2014 had a similar study, randomized trial again, 64 patients, patellar tendon autograft, 8 weeks brace, no brace. 52 patients had, or 81%, with follow-up at 4 years, and again, no difference in failure or any other outcome that was assessed. I could go on these studies because Yang et al. Did a systematic review in 2019 where they showed 7 randomized controlled trials of patellar tendon reconstruction for ACLs, 440 total patients, no individual study demonstrating an effect, and no effect of bracing overall on failures, patient-reported outcomes, or any laxity assessments in any study. So that's patellar tendons. What about hamstrings? Cruz et al. In 2012 did a randomized control trial with 138 patients, 1-year follow-up, brace for 6 weeks or no brace for 6 weeks, and they noted, again, no difference in the two groups, with 2 failures noted in each group. Similar study by Gundheim et al. Just recently here this year, 84 patients, mean age 31 years, ACL reconstruction, hamstring autograft again, brace or no brace postoperatively for 6 weeks, 75 patients with 1-year follow-up, and again, no difference in failure risk, no difference in outcomes, and they even stratified by whether they did a meniscus repair, and again, no difference. So what about allografts? Unfortunately, there weren't really any randomized or comparative trials in the allograft space, and there have been some recommendations from various authors for or against bracing. Clearly, more data are needed in this space, so we don't really know. So what about the effects on recovery? I think we've shown that these braces don't necessarily help, maybe, but I wonder if they hurt. This is a study of 60 subjects, a mean of 28 years, randomized to a brace for 2 weeks post-op and then a functional brace for the next 10 weeks. They monitored compliance here as well, noted no failures in either group, and they did note inhibition of strength at 3 months in the braced group and lower knee scores, but this was all similar by 2 years post-operatively. What about specific situations? Revisions, patients with knee hyperextension like we talked about earlier, greater than 10 degrees, Ehlers-Danlos patients, etc. Not surprising here, we're really lacking data in this particular space. So post-operative bracing, I would say there is no evidence for routine use of post-operative bracing with an autograft. With an allograft, evidence is lacking, and there may be specific situations that we don't have good answers. So what about functional bracing? This is clearly more controversial, and it may vary depending on specific braces and activities, and there may be some psychological components here. McDevitt et al. Did a nice randomized control trial in a military population where they looked at BTB autografts with or without functional bracing for all twisting activities up to 2 years, and they found no difference in failure risk between the two groups. In a similar active patient population, Birmingham et al. Had a prospective trial, 150 subjects, 27 years old. Again, brace, no brace for all activities up to 2 years. And again, no difference in failure risk or patient-reported outcomes between groups. So how about your higher risk athletes, your teenagers who are returning to twisting and pivoting sports? This is not a randomized trial. This is a retrospective cohort study where they had two groups, one that received bracing and then a matched cohort group that did not. And they actually did note decreased risk of failure in the braced group. Similarly, a study of skiers, again, not randomized, but another cohort study. This is a prospective study, skiing with or without a brace. Again, we did see a slight decreased risk of tears with brace, but again, these are not randomized trials. So small RCTs have demonstrated no difference in the general population. There may be specific populations that can benefit from functional ACL bracing, including adolescents returning to twisting sports and skiers, and maybe others. So there are very few limitations, or there are a few trials here. We need more data, and there may be differences from brace to brace. Also, studies didn't really stratify for things like other risk factors, including slope. And again, the majority of these studies evaluated isolated tears without LET. So in conclusion, in my opinion, there's really no data for routine post-op bracing of ACLs. There may be a role in specific populations. Functional bracing may not be required in a general population, but there may be specific cases where it can have benefit, and we need some more data here. Thank you.